Coming up on American Medicine Today, a new documentary has the left up in arms and doing whatever they can to cancel screenings. Dr. Steve Turley joins us to discuss the recent impacts of the film, The Return of the American Patriot. Then Faye began experiencing terrible pain in her lower lumbar that was preventing her from performing routine daily activities. See how the patented Bonati spine procedures got Faye back out and playing in her garden, pain-free. Finally, Dr. Bonati discusses a new cancer screening test that promises higher accuracy than any other test available. Learn more about the Galleri Test and how it could potentially change the way we screen for cancer. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside our friends Ethan Youker and world-renowned orthopedic surgeon, Dr. Alfred Bonati. A new documentary film that's being called the Woke Left's Most Hated Movie has had several screenings canceled by some venues due to leftist woke pressure. But the producers won't be deterred. Joining us to discuss is Dr. Steve Turley, host of Turley Talks, and one of the men behind the film, The Return of the American Patriot, The Rise of Pennsylvania. Welcome to the show.
Oh, it's great. Thank you so much for having me. It's an absolute honor.
Why don't you first tell us about the film? Why was it made, and what about it, and why the backlash?
There you go. Well, it's a wonderful story of how ordinary Americans who've never been involved in politics rose up and mobilized to successfully take on unconstitutional COVID mandates, election integrity issues, woke school boards all across the state of Pennsylvania. Pennsylvania is in the backyard of both myself and my business partner, Ralph Cochran. He's in Pennsylvania proper. I'm in Delaware, about 20 minutes from Joe Biden's basement. So, and about an hour away from where he came crashing down to the ground in Biden Falls, which you can see on Google Maps. But,
it's on Google Maps. You got to get out of here.
You got to get.
That's hilarious.
And we saw it firsthand. We saw this incredibly inspirational story of people effectively pushing back against the permanent political class. We told people about it everywhere we went. Arizona, you name it. And they said, oh, I wish we had something like that here, or I wish I could have seen it. And we said, well, you know what? We're gonna make a documentary so you can. So we did that. We filmed over the course of a year, and it climaxes with the nomination of Doug Mastriano for governor. And you would think that anyone who was a supporter of democracy would be very interested in this film. But little did we know that the very drama we captured on film would actually play itself out in real time for the premiere. We scheduled the premiere of the film for the weekend of July 16th over the summer. It was at a local IMAX theater in Lancaster, Pennsylvania. We sold, it seated 400 people. We sold 400 tickets literally in hours. It was amazing.
Wow.
And then just days before the premiere, a group of woke activists called Stand Up Lancaster cry-bullied the movie theater to cancel the premiere. And unfortunately, the owner of the theater caved and canceled our contract just days before the scheduled viewing without a venue. We did find another venue that hosted the Republican State Convention in Pennsylvania, Wyndham Hotel. They had 800 seats available.
Wow.
We sold out of that in hours. So we doubled the capacity. But then that same mob came after them and they canceled.
What?
And then, back to back in 2 days, hours, we were canceled back to back. But then God bless these men. We had two pastors from a church, Christ Community Church at Camp Hill. They have a 1,200 seat auditorium replete with a movie theater quality sound system, massive screens. They offered it to us. Immediately when word got out, leftists started threatening the church with lawsuits and contacting the IRS. I mean, think about it. These people had nothing else better to do than to threaten a Christian church. But God bless these pastors. They did not buckle for a minute.
Good.
We ended up tripling our attendance. All 1,200 tickets were sold. We had an amazing premiere. Doug Mastriano himself came, sat in the front row, and in the end, 7 protesters showed up, and they had to stand outside in the rain. It was glorious.
You got some dedicated 7 wokesters there. So you went ahead with the screening anyway. What was the response from the 1,200 people that were there?
Oh, it was amazing. We got a massive standing ovation. They couldn't have been more excited. And we've actually had several showings all across the state, just by interested groups, just doing it themselves, getting the word out, finding a venue, and hosting it in primarily rural areas where no woke people would come with even 10 miles of the area.
Woke-free zone. Yeah.
That's it. It is a woke-free zone. It's real Americana, and it's just been an absolute delight to see.
They labeled it all sorts of things like white supremacy propaganda. They're extremist. How do they come up with this narrative when they're not even familiar with the movie?
Yeah,
it's absurd.
At least book burners read the books. Yeah,
Right.
We just had that Dearborn, Michigan school board that got shut down, and part of the reason why it just got shut down is actually parents got up and read from these crazy pornographic books that were in their library. They were reading it. These people had never even seen the movie, you say. So no, the key here is they didn't cancel us because we're Christian nationalists or fascists or white supremacists. They needed to cancel us. They wanted to cancel us. And therefore, we were Christian nationalists, white supremacists, and fascists. You see, the canceling comes first. That's the Banana Republic kangaroo court element, like we're seeing with the January 6th committee. The verdict's already in. Then they just have to find some way of justifying it.
Here's the interesting thing here, Steve, is that it's been labeled by, as you just mentioned, the woke left, who have never seen the film, and they're calling it white supremacy and extremism. Yet apparently, not only have they not seen it, but it eludes them that Joshua Williams, who's the director, the man whose idea this was to make the film, is a black guy. How's he making white supremacy propaganda if he's a black guy? Well, they might know had they watched it.
Keep in mind, Ethan, Larry Elder was a white supremacist, right?
True.
Winston Sears was a white supremacist. But then again, these are the people, I don't know if you've ever seen Rachel Levine, the transgender, I don't know, she's in something with Health and Human Services. She comes from Pennsylvania. So these are the same people who actually think Rachel Levine is a woman. So.
So they weren't able to cancel this film. I know. So are they still trying? Like, is it accessible? Can people come out and see this?
Oh, yeah, no. We're streaming it now. It's totally accessible. They can go to the returnoftheamericanpatriot.com, can watch it on demand there. We've rolled it out very similar to the way 2000 Mules was rolled out on locals. So returnoftheamericanpatriot.com. And again, you have showings all over the state, just interested groups, patriot groups showing it. They're just so excited about what's happening in their state. And they know that if it's happening in Pennsylvania, it can happen anywhere.
The name of the documentary is The Return of the American Patriot. Even that has become sort of a buzzword. If you're considered a patriot, you're hateful, you're a white supremacist. And they've taken that's how they've labeled that term now. So it's almost like derogatory to refer to anyone as a patriot. It blows my mind how far they've gone off the rails.
The tolerant left.
The tolerant left.
Yeah.
That's the biggest joke.
It goes back to a fascinating concept called repressive tolerance. Herbert Marcuse in the 1960s. You can tolerate anything on the left, but nothing on the right. So our tolerance is inherently repressive. If that's not a square circle, I have no idea what is. No wonder we don't know what a woman is anymore.
We don't know what anything is anymore, except the Biden regime needs to get out and we need Trump back in the White House.
That's right. Amen to that.
Thank you so much, Dr. Steve Turley, host of the Turley Talk Show and one of the men behind the film, The Return of the American Patriot, The Rise of Pennsylvania. Thank you for being on the program.
Thank you, guys. God bless you.
Make sure you stay tuned. Coming up after the break, a story of recovery. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect 98.75% patient satisfaction. 70,000 procedures have been performed exclusively at our location. Nearly half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. If you ever get the chance to visit Vero Beach on the east coast of Florida, don't pass it up. It's everything you'd want in a beach town, but in a casual and relaxing setting. We were fortunate enough to visit the area to meet with Bonati Spine Institute patient Faye E.
My name is Faye E, and I have lived in Vero all my life. I was born in West Palm. I'm married to a wonderful husband that supported me through all of my surgeries. I have 2 children, 2 grown children, and I have 5 grandchildren. I love gardening, which I'm happy to be back doing again. I do love shaping my topiaries and my bonsai, and I have a hydroponic vegetable garden, and I love working with that. Cooking's one of my hobbies, and my husband's the beneficiary of my cooking.
She described how her mild back pain had escalated over the years.
I've had back problems. I have mild scoliosis, and so I've always had some back problems really all my life, and especially after childbirth. I'm so active. We do a lot of 12,000-foot altitude mountain climbing out in Colorado, which we'd just love to do, and I got to the point where I could no longer do that. So I went to my spine doctor that I've been to for the past probably 10 years. I've been going to a local doctor here. We've done epidural injections. We've done physical therapy. We have run the gamut. It would temporarily, I use the TENS unit, massage therapy. I have a chiropractor that I go to, but most things were temporary. The pain was in my lumbar area. It started out shooting pain down my right leg, and got to be so bad I could not stand more than 10 minutes or walk more than 10 minutes. And then it got to the point where I could not sit down. Right before I went to the Bonati Institute, I was flat on my back for 2 weeks before I found relief.
When various types of conservative treatments were no longer providing her with relief, a longtime friend stepped in and told her about the solution that she could find at the Bonati Spine Institute.
I went to my massage therapist and was coming out, and at that point I could hardly walk on my right leg. It would give out on me if I was walking any distance, and it was just so painful. And a friend of mine was at the reception desk that I went to high school with. She looked at me and she said, "Faye," she goes, "what's going on with you?" And I said, I've been having some back problems, and then we moved a few weeks ago, and I, picked up something, and then that was it. I said, the pains just got worse and worse. I was just in tears. I was in so much pain. I was on hydrocodone by that time, and it was just horrible, because I've always tried to do everything as natural as I can, and to be on the pain medications that I was on, I was to a point where I had to do something. And even my personal trainer, she told me, she says, "Faye," she says, you've got to do something different. You need to find out what's wrong. And sure enough, whenever I ran into my friend, she came over a day or two later, and I was flat on my back at that time. She came and visited me in my bedroom. She came and she says, "Faye," she says, "I had surgery at the Bonati Spine Institute in 2010, and she goes, I've been pain-free ever since." She said, "I was ready to shoot myself. I was in so much pain." And I was at the same point. Monday she visited. Tuesday we contacted the Bonati Institute. Wednesday we heard from the Bonati Institute, and I told them that I was getting my MRI on Thursday. We got the report to them Friday morning, Friday afternoon, they had reviewed my MRI and asked if I could come Monday. Dr. Bonati has a gift of caring for people. It was just a wonderful experience.
Performed using conscious IV sedation and a local anesthesia, the Bonati spine procedure's unique approach allows the surgeon and the patient to work together to locate and eliminate the exact cause of the pain.
I think it was in my second surgery. They commented after the surgery that I was very talkative. My first surgery, I don't remember a whole lot. The second surgery, I turned my head and was watching the monitor for a few minutes. It wasn't scary at all. Right before you're coming out of surgery, they ask you to move your arms and your legs to make sure that everything is in working order.
Due to the patented techniques available only at the Bonati Spine Institute, procedures are targeted and result in a recovery period that's just a fraction of the time it would be compared to those having traditional open back surgeries. Faye is back in the garden and preparing for her upcoming hiking vacation.
Oh my goodness, it was such a relief. I could feel the difference. I mean, I could actually walk and stand. 2 weeks after surgery, I was ready to get my life going again because I felt that good. And my incisions healed up very well. So I was doing some things out here in my yard again and enjoying the things that I love to do. My gardening and flower arranging. I loved flower arrange. I'm back sitting at my computer with no pain. Before I couldn't even sit at the computer for, more than 5 minutes at a time. I rode my bike for the first time over the weekend. I haven't ridden my bike in 3 months. And we're looking forward to going to Colorado in late August. So I'm sure I'll be able to do some hiking again. I just started working out last week with my personal trainer that I've had for 30 years. And she can't believe it. I mean, she said, "Faye, you should have done this a long time ago." And I said, "Yes, you're right.
Faye had such a wonderful experience and is very thankful to her friend who told her about Bonati. She hopes that she can make a difference in someone's life by referring them as well.
It was a godsend that I ran into my friend and that she had experienced the same thing that I experienced. And I'm hopeful that the friends and people that I have given the address to, and I have it in my phone, and so now I can just send that contact to whoever asks for it. And I hope they can benefit it as well as I have. I would say if you need back surgery, there's no sense in living in pain. It is so easy to just go over there to the Bonati Spine Institute, and I highly recommend it to anybody.
Bonati was the one that helped me completely. Thank you for giving my career back to me.
The good news this time is it was not open back surgery.
They did give me my life back.
This scar is this big.
He was a doctor that didn't want to fillet my back open like a fish.
During the whole operation, I was awake. I was talking to the doctor.
He's not really cutting muscles, he's just pushing them away.
Immediately after the procedure, I was able to stand straight again, and I had zero pain.
Well, he did the surgery on the left side, and a week later, I was back in the gym.
Don't wait until you're on that downward slide where you can't even function anymore.
When somebody can help you to where you can recover and where you can do the things that you were able to do before, you just become thankful.
I can't thank the Bonati Institute enough for giving me my life back.
It just opens up doors that you thought were closed.
I love you, Doc.
Welcome back to American Medicine Today. So, Dr. Bonati, you wanted to continue the discussion about cancer and early diagnosis. What can we do?
One of the important things in medicine is that we really know early what is wrong, so we can early tackle the problem and try to correct it. When you talk about early pain or early cancer, then you may be able to have answers that they are proper at that time and correct the situation for the patient. If the diagnosis is early and this person had a small little lump on the breast and decided to have a biopsy, they did the biopsy, and in the process, a big machine of cancer came to work with her.
Okay.
That means you have diagnosis, you have treatments, and the treatments were treatments associated primarily with treating with therapies that they are more damaging to the body and to the defense mechanism of the body than really treating the cancer. So I start to look at that and I say, why we don't have an early study? And I look at the early studies in other cancers, and I found that, yes, you do colonoscopies.
Yes.
But the problem is you can be catch with a colonoscopy at the time that you are dealing with small polyps.
Okay.
And the polyp is a precancer lesion.
Sure.
So you need to tackle that immediately.
Don't they only say to come in after age 40 and then you do them every 3 to 4 years?
Well, this is exactly what I'm trying to get into. I'm saying early diagnosis because people with 30 years old have cancer.
Yes.
And people with 20 years old have pain.
Yeah.
So we need to diagnose from where the thing is coming as soon as possible to treat as soon as possible. Well, I'm going to continue with this lethal type of a disease because it's affecting society so bad that everybody has fear of cancer.
I think the stat, Doc, because we actually had an oncologist expert on, I think it was 70% of people over 60 at some point in their lives will develop cancer. 70%.
That's staggering.
Yes.
Yes.
Well, it's so staggering, but you know something? We don't have a way to test it. So I believe that there are tests that they are very good. And that's what I want to discuss because we need to change the way that we look cancer. Cancer is a disease like everybody thinks. And if you have a cut in your leg and you don't clean it and you don't put antibiotics and you don't do the things, you may have an infection. You have an infection, you may lose your leg or you may lose your life. Why? Because you have an early diagnosis. You treat that properly at the beginning and you stop the problem that may happen.
Correct.
Okay. Well, we don't do that in cancer. They can do a PET scan.
Okay.
And the PET scan will show the early cancer. But it's the better test than that.
What's that?
It's a blood test.
Okay.
And this test is being called the Galleri Test. And the Galleri Test is so effective. Right now in cancer, 10% of the cancers are false positives.
Okay.
So that somebody diagnosed you in cancer and you don't have cancer.
Right.
Okay. But that is a 10% of good tests. The best test is 40%. So almost half of the people who's being diagnosed of cancer, they don't have cancer. But the expensive that a person needs to go and the fear for the family and the tremendous amount of stress that you go in trauma destroy families. It's a test that if you go and say, 1st of January, I'm going to do my Galleri test. And you do the Galleri test, and the Galleri test does two things. First, 0.5% of this test will be false positive.
Wow.
Look at the numbers the astronomical numbers on the thing. 40% of the tumors are diagnosed in stage 1. So half of the cancers can be wiped out with that test.
Sure.
Because you have a way to treat it. 64% of the people that they have cancer, they are in stage 2. So it still can be very fairly treated well and avoid the death. So if you have your Galleri test at the beginning of the year,
you can set your baseline,
and then you do a Galleri test in the middle of the year, you are ahead of the curve because you have no cancer on the beginning, you have no cancer in the middle of the year. Then you repeat your the next year.
Yes.
And if you do this, and what is this test? This test is a blood test. And how it works? This cancer cell dies in the body and sheds the DNA of the cell.
So a test for that DNA?
Then you test the DNA of the cancer cell. Wow. When you test the DNA of the cancer cell, now the test is telling you, yes, you do have cancer, but it's telling you something else. Tells you immediately from where that cancer is coming. If you are in stage 1, and then they tell you have a kidney tumor that is in stage 1 of cancer, well, you have the opportunity to take that kidney out.
Right.
All right? Or that intestine resected. The incredible amount of solution with this test is something that needs to be promoted, and they needs to be talked by the doctors, and they need to be put in the media because we can save lives just because this test is so accurate.
It's unbelievable you're mentioning the name of the test, but nobody else has covered it. Insurance companies don't allow you, at a minimum, a yearly test like this. And it seems like we love to play catch up with chemotherapy and those sort of things once cancer has already gotten out of hand. And this is something that can help the process and prevent you needing those therapies.
And the beauty of this is only a blood test.
Yes.
It's the same amount of damage that they are going to use when they take blood to just check normal studies.
Thank you for that knowledge, Dr. Bonati. Hopefully we can start to save more lives. Thank you for watching American Medicine Today, and make sure you check us out next Saturday, 4 p.m. Eastern, right here on Newsmax. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.